What's up, guys? How's it going? Cade Moore with More Muscle. Today, I'm going to be talking about something interesting, just the health fact of the day. We're going to be talking about Crohn's disease, guys. So Crohn's disease is interesting, and we're going to get to it. So let's get to it. So, guys, Crohn's disease is an inflammatory bowel disease, causes swelling in tissues. It can cause severe diarrhea, fatigue, weight loss, malnutrition. And this inflammation can spread to the other layers of the stomach, of the bowels. And you can have some healing and some readmission with this. Some symptoms include diarrhea, fever, fatigue, abdominal pain, cramping, blood in the stools, mouth sores, reduced appetite, weight loss, and pain due to the inflammation. In Crohn's disease, any part of your small or large intestine can be involved. The disease is only in the colon, right? Or in some people, the disease is only in the colon, but it can be anywhere. And some other people that have Crohn's disease can get inflammation of the skin, eyes, and joints, inflammation in liver or bile ducts, kidney stones, iron deficiency anemia, delayed growth or sexual development in children. So, guys, that iron deficiency anemia, guys, so what happens is when Crohn's disease is basically your stomach is not absorbing the nutrients, right, and you're having inflammation, right? And so when you can't absorb those nutrients then you can get stuff like iron deficiency anemia because you can't absorb the iron. So what you want to do is if you see if you have abdominal pain, if you have blood in your stool, nausea and vomiting, diarrhea that lasts longer than 2 weeks, or unexplained weight loss, or even like a fever, that could be a problem with that could be a cause of Crohn's disease, right? So Crohn's disease is like unknown, like what happens and why it happens. But listen to this, guys. Every single person I know that has had Crohn's disease drinks a lot of Diet Coke or like diet drinks, diet sodas. Every single person I've known drinks a lot of diet sodas. So I'm not saying diet sodas cause Crohn's disease, but in my lifetime, I have seen a lot of people that drink lots of diet sodas and they have Crohn's disease. I'm not saying that it causes it. I'm not saying diet soda causes Crohn's disease, but I've seen it a lot. And I'm not saying there is a correlation, but I 100% think there could be a correlation. And no, there's not any studies on this that I know of, but if there was a study, I think it would, lead to it. Anyways, guys, we'll talk about the immune system. Usually it's possible that the virus or bacterium may trigger Crohn's disease. However, scientists have yet to identify such a trigger. When your immune system tries to fight off invading microorganisms or environmental triggers, an atypical immune response causes the immune system to attack the cells in the digestive tract. So basically what it's saying is it's an immune disease. Basically you're fighting cells that, fight off diseases and stuff. They attack your stomach. And there's a lot of hormonal diseases like that. There's type 1 diabetes is actually like that, where your body basically destroys the insulin in your body. It thinks it's something bad and it triggers an autoimmune response, and then your body can't make insulin anymore. So that's kind of how Crohn's disease works. Basically, some risk factors include age. Crohn's disease are usually diagnosed before they're around 30 years old. Ethnicity, sorry, can't speak right now. So certain ethnicities have higher risk of Crohn's disease. Family history and cigarette smoking, guys. So when you're smoking, you're more likely to get this. And this is important, guys. So non-steroidal anti-inflammatory medications. These are like ibuprofen. So when you use these a lot, guys, it can actually cause you to get Crohn's disease. It can increase your risk for Crohn's disease. So that's one thing that we don't really talk about. I think it's just so normal to just, hey, if you're not feeling good, pop some ibuprofen, right? Or do something like that. Guys, we got to look at the risks, because even drugs that are so common that are over the counter, they can sometimes be harmful in excessive amounts, and when not taken correctly. I got a lot of friends that they'll take like 8 ibuprofens like it's nothing, when ibuprofens can be very toxic to the liver. And so you got to, even though ibuprofen's not like a super strong drug, we still got to be careful on how we use it, and especially these over-the-counter drugs that are still can be very harmful. So over the time, part of the, like after a while you have Crohn's disease, part of the bowels can scar and narrow, which can block the flow of digestive contents, and sometimes you got to get surgery for this. They can also cause ulcers in your stomach and in your mouth, and even malnutrition, cancer, skin disorders, and other health problems. And there are some medications that can help with Crohn's disease. You can get your blood tests, you can get stool studies, you can get a colonoscopy, and you can take corticosteroids that might help, because that's going to suppress the immune system temporarily, and it's not going to make the stomach, not going to make the immune system attack the stomach. So anyways, guys, this is interesting. Crohn's disease isn't something you want to have. It's at the stomach where you can't get that nutrition you want. And anyways, guys, thanks for watching. Hopefully you learned something, enjoyed it. Subscribe. Thanks.